So I think that, especially our patients with drug-resistant epilepsy, that some of this is about the conversation and about that. Sometimes they may say, sometimes they may say a seizure a year or maybe less or even more frequent is okay because I don't want to risk changing medications. I don't want to risk changing treatment opportunities. And so some of this symposium is going to address that. It's going to address that there is an impact to continuing to have seizures. There is an impact even to one seizure a year or even one seizure every 5 years. And to kind of talk about the discussion to have with the patients, but also to reevaluate new data and new opportunities for these patients and to look and see where the field is moving in the future. We know, based on Quan and Brody's previous data, that the efficacy in patients with drug-resistant epilepsy has not changed for many years. And now with new treatment opportunities, there might be changes, there might be reevaluations. And so that's important for providers to hear. And my talk is really talking about, is highlighting the importance of that in the eyes of the patient, and that these continued seizures really are a call to action to look for other treatment opportunities to try to reduce some of these comorbidities, stigma, limitations in life, and improve quality of life. I think a lot of it is education. So it's education for providers to talk about these new opportunities, but it's also education for patients and caregivers to learn about these new opportunities, to not give up, to strive for better seizure control, 0 seizures if possible, that there are new opportunities coming out there. And even if opportunities may not have worked in the past, newer developments may work. And so as far as stigma, I really think it's about education, as you said, about how to improve quality of life, how to reduce drug load, how to reduce cognition, right? How to normalize the lives of people potentially with epilepsy, but also try to give back some of that independence that's been taken away. AAS is, I think, something that many of us look forward to every year. And there are many opportunities. It's not just about networking, but it's about learning what has changed in the field in the past year, even in the past several years, with new data coming out. And even we look forward to networking, but we also look forward to getting to see new advances in treatment and technology in options and opportunities for our patients. And so I think, AAS is something that all of us try not to miss, because it shows us where the field is going, and every time I leave AAS, I'm more motivated, and my enthusiasm is reinforced of the opportunities that we have for our patients and for epilepsy as a community.